Welcome to the Find from FRPN-Funded Project 4 Fatherhood and Public Policy webinar. All lines have been placed on a listen-only mode. If you would like to submit a question at any time during the webinar, you may use the chat box located on the lower left corner of your screen. Simply type your question into the box and click on the send button. If you should require assistance throughout the conference, please press *0 on your telephone keypad to reach a live operator. At this time, it is my pleasure to turn the floor over to your host, Jessica Pearson. Ma'am, the floor is yours.
Thank you, and welcome. Good afternoon, and welcome. I am Jessica Pearson. I direct the Center for Policy Research in Denver and co-direct with Jay Fagan of Temple University, the Fatherhood Research and Practice Network. Today, we are very pleased that we're going to be able to introduce you to 4 projects that we've had the privilege of funding through FRPN and hear presentations about key findings. Today's webinar is being recorded, and the slides and the recording will be posted on our website and also announced in a forthcoming newsletter, electronic newsletter, and you will also have access to the final reports for these studies. Let me tell you take a few moments to tell you about FRPN. It's originally a 5-year, but now we've stretched it to a 6-year cooperative agreement between the Office of Planning, Research, and Evaluation, Temple University, and Center for Policy Research. It ends at the end of this month, December 30th, and we have targeted fatherhood practitioners and programs that serve low-income fathers. It's a multifaceted initiative aims to promote rigorous evaluation in the fatherhood field, and to that end, we have funded 20 subawards, and though you're going to hear about 4 of them today, which involves original research conducted by university researchers, often in collaboration with community programs or fatherhood initiatives. And we've also been very active in trying to build evaluation capacity by communicating research findings to the practitioner community. This is our 22nd webinar that we've held over the past 6 years, featuring key research themes and practice themes and policy themes dealing with fatherhood. Finally, we are committed to information dissemination. Our website, frpn.org, contains the work of all of our sub-grantees and our own original research on fatherhood measures, co-parenting research, and policy initiatives in fatherhood area. So please check the website and sign up for the newsletter to receive postings of new work and additional activities, which will continue on the expiration of federal funding on December 30th. So why are we focusing on fatherhood and public policy? Well, we are doing this because the nexus or fatherhood and fatherhood programs operate in a larger societal context, and there's been little direct investigation of the impact of state and federal policies on fatherhood and on fathers. The Administration for Children and Family issued an information memorandum about a year ago, last October, calling on all human services agencies at the state, local, and federal level to do a better job of enhancing father engagement, and not just the typical or the traditional agencies that work with fathers as child support, but they are targeting child welfare agencies, family and youth services, child care, Head Start, family violence prevention, etc. Designing effective engagement policies and strategies will be challenging. There will be all kinds of worker training and retraining efforts that will need to be initiated, all kinds of obstacles to overcome. And as you'll hear more today, policies often have unintended consequences, unexpected outcomes, and policies are implemented differently depending upon agency setting and staff. So all this, these are the good reasons why both research should focus on the policy arena, and why practitioners and policymakers need to be aware of how they affect what happens on the ground. Today's presentations deal with employment among fathers with criminal records, Child Protective Services investigated maltreatment by fathers and how it's handled by CPS agencies, the inclusion of fathers with families in homeless shelters, and addressing domestic violence in fatherhood programs. We have a very ambitious agenda, so we're going to go faster than we might all like, but there will be opportunity for questions at the end, and that's why we are reserving time for that type of discussion. The first presentation will be presented by Allison Dwyer-Emery on behalf of the team from Rutgers University, dealing with state policies and employment outcomes among fathers with criminal records. She'll be followed by a presentation by Julia Kowalski and her colleague Rachel Wildfler on Child Protective Services investigated maltreatment by fathers, and their focus on the characteristics of those cases and outcomes. Third presentation will be by Karen Garg and Karen Hudson of Temple University, and they will be presenting on adoption, implementation, and consequences of the inclusion of fathers with their families in homeless shelters. And the last presentation will be by Christy Thomas on behalf of herself and Fernando Medeiros of Simmons University on responsible fatherhood groups and domestic violence education, and they did an exploratory study of current practices, barriers, and opportunities. We're going to start with Allison and the presentation on state policies and employment outcomes among fathers with criminal records. Allison?
Great. Thank you so much, Jessica. So again, this is Allison Dwyer-Emery, and I'll be presenting our paper looking at state policies and employment outcomes among fathers with criminal records. And there's a link here so you can see the full report, which is already posted up on the FRPN website. So I encourage you, I'm going to have to go quickly through things, but if you have questions, please look up that report. So we're addressing two different questions with our study. First, do fathers who have criminal records face an employment penalty? And then second, we're trying to understand the extent to which different state policies can either shrink that employment penalty or make it grow for different fathers within that state. So within, yes. Ooh. Okay. So the motivation for this is that 1 in 3 Americans have a criminal record of some kind. And while we don't have great information on how many of individuals with criminal records are parents, we know that the majority of incarcerated persons in the U.S. are parents. So it's likely that most people with criminal records are also parents of some kind. And contact with the criminal justice system is going to disproportionately impact Black families in the United States. So for men, having a criminal record means that they're less likely to be able to find legal employment and that they're going to have more difficulty both supporting themselves and supporting their children. Now, state policies, which is what we're interested in this particular study, are interesting because they have a lot of potential for helping solve some of the systemic issues that individuals with criminal records might face when they're trying to find employment. But there's also some mixed evidence out there. That means it's not a clear-cut case. So ideally, these state policies might help improve employment by removing some of the legal barriers faced by individuals with records. But there are some studies, particularly looking at policies like Ban the Box, that suggest that policies also inadvertently create the conditions for more racial discrimination. So we're specifically looking at 2 different kinds of policies. The first are what we're calling the employment policies, which we've collapsed into a single employment policy index. Now, these are 6 policies that look at whether private employers, public employers, and licensing agencies are allowed to either consider arrests that do not lead to convictions, or whether they're allowed to have blanket bans against hiring individuals with criminal records. And the second set of policies we're looking at are examining the availability of state searchable online criminal records databases. So looking at whether states make criminal record information available online or whether they only make the records of individuals who are currently under supervision, being incarceration, probation, or parole, available, or whether they don't have any kind of searchable online database. Now, when I put those different policies up on a map, starting with the employment policies, what I want you to see is that there's a lot of variation across states what kinds of policies they have in place, ranging from a state like Wisconsin that has very protective employment policies on the books. So in Wisconsin, neither public employers, private employers, nor licensees are allowed to consider arrests that didn't lead to conviction. And there's many regulations about whether they're allowed to have, what kinds of criminal records they're allowed to take into consideration when making their decisions. On the opposite end of the spectrum is a state like Texas that has none of these protective policies in place, meaning that the use of criminal records is going to be largely up to the discretion of individual employers or licensing agencies. So with those policies, there's a lot of variation across states, but relatively little variation over time. So most states are no longer starting to implement kinds of policies. Many have moved on to ban the box policies, which are slightly more recent. Now, if we look at the access policies, we see both variation across states and variation over time. So we're looking at a subset of the states for these access policies, largely because these are the states line up with the data on fathers that we have, which I'll talk about on the next slide. So here we see that there's a range over time as states start to get more of these online databases set up. So again, the most protective states are not going to have online access to criminal records, and the least protective states are going to have searchable online databases that make all kinds of criminal records widely available. So we're merging this information on state policies in with data on from the Fragile Families and Child Wellbeing study. Now, this is a longitudinal birth cohort study of about 5,000 urban births, with, importantly for us, an oversample of non-marital births. Now, these families were followed from birth all the way up through year 9, and again, importantly for our study, fathers were also interviewed at each of these waves, even if they were no longer living with their children. So because this is a relatively disadvantaged urban sample, and because of the special attention paid to fathers within this study, it has ended up being one of the best studies available for understanding the implications of criminal justice contact on families in a wide number of states. And as I mentioned, the fathers were independently interviewed at each of these different follow-up waves, which, and again, importantly for our study, the fathers actually report on what kind of contact with the criminal justice system they've had at each wave. So we have a sample of about 3,000 fathers, and then when we pool it across different waves, we end up with about 10,000 observations. With fathers by race, looking at their different kinds of levels of contact with the criminal justice system. So what we see here is that 29% of white fathers and Hispanic fathers in our sample have had contact with the criminal justice system that reaches the level of likely having a criminal record, and that's 43% for Black fathers. So what we mean by those who are likely to have a criminal record is that they have self-reported either having been arrested, convicted, or incarcerated at some prior point. Now, I also want you to note that many of the fathers in the sample, even the fathers who haven't had a criminal, don't have what we would count as a criminal record, have still had contact with the police, making them a really great comparison group for our questions today. So to evaluate our data, we're going to be using random effects linear probability regression models. And again, I'm going to refer you back to the study for greater detail on what exactly those models mean. But in short, we're going to be looking at what the effect of having a criminal record is on the probability that fathers are employed, and then look at whether that association, that employment gap or employment penalty, varies if fathers are living in different kinds of state contexts. And throughout all of this, we're controlling for a wide range of time-varying measures for a father's risk of criminality, his demographic attributes, and state controls as well, which I'm happy to talk about in the Q&A if you have any follow-up questions. But to get right to the meat of our study, the first question that we are addressing again is there an employment penalty or a gap or a negative consequence for having a criminal record? So looking at this graph, I want you to first note that the majority of others, regardless of race and regardless of criminal record status, are employed in our study. So this is not this is a sample of fathers who are still engaged with the formal economy. But that having a criminal record is associated with a lower probability that fathers reported having employment, particularly for fathers who are Black or Hispanic. We see a slightly smaller employment penalty for white fathers, just shy of being statistically significant, but still apparent when we look at this graph. So our next question then is, do employment policies, again, these are the policies that regulate the extent to which employers and licensing agencies can take into account criminal records, do these kinds of policies make things better or worse for fathers with criminal records? Now, there are such stark differences by race that I'm just going to start going over what these findings mean for fathers separately by race rather than talking about the all fathers. So when we look at Black fathers, the first thing that jumps out is that Black fathers with criminal records are 15 percentage points less likely to report being employed if they're living in the states with the most protective policies in place. So for Black fathers living with criminal records, living in a state that has more protective policies in place was associated with a lower probability of employment. Now, when we look at Black fathers who do not have criminal records, living in those most protective states, we see that they are 10 percentage points less likely to be employed than their counterparts living in states where records are left up to individual discretion. Now, this is counterintuitive because these policies are intended to try to increase access to the formal economy. But what we see is that there is a negative association with the employment of Black fathers both with and without criminal records. Now, as I alluded to on the first slide, this isn't entirely unexpected because there is a large and growing body of research suggesting that lots of policies that have tried to address discrimination on other fronts, whether through ban-the-box policies, drug screening tests, or other kinds of policies like that, can have this unintentional, inadvertent, negative implication for racial discrimination, which is exactly what we're seeing here. So when we look at white fathers, we see there's no real association here. So white fathers either with or without criminal records, are equally likely to report working regardless of what kind of state policy regime they're living in. And when we look at Hispanic fathers, we see yet another pattern of results. So for Hispanic fathers, we see that there is a larger employment penalty. And by that, I mean the gap between the level of employment reported by fathers without criminal records and with criminal records. So that gap, that employment penalty, is larger, again, in the most protective states relative to the least protective states. Unlike with Black fathers, though, we don't have a lot of literature to lean on to help us explain why this might be the case. So this is an area where we need a little bit additional research, some more research to figure out what exactly is going on with these Hispanic fathers, because all we can say at the moment is that it's a very different pattern than we see reflected in the experiences of the Black fathers in our study and the white fathers in our study. But I wish there was a little bit more prior research out there that could help us benchmark our findings and make sense of them a little bit more. So when we look at the second set of policies, so these are these policies regulating whether states provide access to online searchable criminal record databases. So how available these kinds of criminal records are, official records through online databases. And what we see here is not much of anything. So regardless of race and regardless of criminal record status, the degree to criminal records are available through official state databases. Doesn't seem to have too large an impact on the likelihood that fathers report employment. Here we see one of our few rays of hope in this study. For white fathers in particular, we see that there is a slightly smaller, about 4 percentage points smaller, so quite small, change in the employment penalty for white fathers living in the most protective states. But I don't want to put too much weight on that because it's, again, very small, and when we beat up the models, it sometimes goes in and out of statistical significance. So something that is maybe tantalizing for future research, but we don't want to put too much weight in here. Okay, so the big takeaway from our study is that it's very difficult to disentangle race and criminal record status when we're trying to craft state policy responses. And that state policies that have the best of intentions and are intended to try to address discrimination on the basis of criminal records can have unpredictable and potentially negative implications for vulnerable fathers, particularly vulnerable fathers from racial minorities. And this is frustrating, right? Because these are the policies that are intended to make things easier for these fathers, and yet we see this kind of negative association. So our main takeaway here is that there aren't going to be any silver bullets as much as we hope that they are, both when we're doing research on fathers and when we're trying to evaluate policies. But rather we might need a wide range of programs and policies to try to address disparities in employment for fathers with criminal records across these different states. And these might include programs that work directly with individuals who have records to place them with employers. And there's some programs like the Center for Employment Opportunities that are doing that kind of boots on the ground work with fathers with criminal records. We might need to do additional work to try to directly address racial discrimination in hiring, access to the formal economy, or to develop more targeted criminal justice policy responses, such as helping fathers expunge records that are no longer relevant, or deal with things like employer liability laws. And I'm happy to go into any of these in further detail in the Q&A if you want more information. So if you want more information, I want to point you toward the Legal Action Center, which is where we developed a lot of our policy coding based on a toolbox that they created identifying legal barriers that individuals with criminal records might face. And of course, you're welcome to reach out to me directly. Again, my name is Allison Dwyer-Emery, and I look forward to any thoughts and feedback that you might have on our project. So thank you, and with that, I'm going to quickly pass us on to the next researcher.
And this would be Julia.
Yep. Okay. Hi, everybody. This is Julia Kowalski. I'm an assistant professor at Temple University, and I'm presenting today with Rachel Wilder, who's a doctoral candidate here at Temple. And we're going to be presenting our research today where we had two goals. First, we wanted to build information about the characteristics of maltreatment perpetrated by fathers and how it may differ from maltreatment perpetrated by mothers. And secondly, we wanted to see if there were disparities or differences in investigation outcomes for child maltreatment reports to Child Protective Services for maltreatment perpetrated by fathers. And the link to our FRPN report is here. We came to this really with a recognition that we need to improve engagement and inclusion of fathers in child welfare. So traditionally, mothers have been seen as the primary nurturers and caregivers of children. And one of the effects of this is that they continue to be sort of the primary service receivers in child welfare settings as well. And there's been some movement to address this, but we have a lot of work to do in really improving the engagement and inclusion for fathers, which is important because we have a growing scientific consensus that shows that fathers have a positive influence on their children. So that being said, if we're talking about child protective services settings, of course, we're talking about child maltreatment and fathers and mothers who have potentially hurt their children. So we need better information on the nature of that maltreatment to guide our service effect, and also kind of the range of that maltreatment. But we also know that with the possibility of gender bias could influence our response to maltreatment perpetrated by fathers. So if fathers are assumed to be less adequate caregivers, they may assume to present more of a danger to children, and these potential biases could lead to disparate outcomes. So we have the two research questions. First, what are the distinguishing characteristics of maltreatment attributed to fathers? So is it different from other maltreatment? And secondly, are there disparities in outcomes of child protective services investigations if we compare maltreatment attributed to fathers versus mothers?
So we conducted a secondary data analysis of the National Survey on Child and Adolescent Wellbeing 2, the NSCOD-2. The NSCOD-2 is a national representative sample of children who were investigated by CPS for maltreatment reports. And the data were collected within 4 months of the CPS investigation being closed. The original sample had 5,872 children, and that data were collected in 2008 and 2009. In our study, we examined the baseline NSCOD-2 data and created 2 analytic samples of children for whom the mother and or father was indicated as responsible for alleged physical abuse or neglect. And as you can see, our samples were 594 children for physical abuse and 1,349 children for neglect. In our analysis, neglect includes investigations of supervisory neglect, physical neglect, moral legal maltreatment, and educational maltreatment. We did not examine sexual abuse because it was rarely perpetrated by the mothers in the NSCOD-2, which really prohibited any adequate comparisons. And we also did not examine emotional abuse because the NSCOD-2 did not collect perpetrator data for emotional abuse. Our independent variables primarily came from the caseworker report. The perpetrator group indicated the individual or individuals responsible for the alleged maltreatment. So mother alone refers to when the mother was indicated as responsible without the father also being indicated as responsible. Father alone, when the father was indicated as responsible without the mother also being indicated as responsible. And mother and father when both were indicated as responsible. And in our analysis, both mother and father are defined as biological or adoptive parents. In terms of maltreatment characteristics, we examined subtype, severity of harm, and maltreatment co-occurrence. The maltreatment co-occurrence variable ranged from 1 to 5 and included physical abuse, neglect, emotional abuse, sexual abuse, and other maltreatment. In terms of co-occurring risk factors, we examined whether or not there are any prior reports of maltreatment to the agency, if there was caregiver substance use, caregiver mental health or emotional problems, caregiver recent arrest or detention, or active intimate partner violence. And the child demographics that we included were age, gender, race, and ethnicity. In terms of dependent variables, right after the end of the CPS investigation, the caseworker was asked to rate their subjective level of risk, so that perceived risk which ranged from 1 to 4. The other 5 dependent variables were based on their more objective report of the outcome of the investigation. So were their services provided or arranged for the family? Was the outcome substantiated? Was there out-of-home placement for the child? Did the allegation result in a criminal investigation? And if so, were charges filed? And then in terms of our analysis for research question 1, which just again was, what are the distinguishing characteristics of maltreatment attributed to fathers? We ran chi-squares and ANOVAs. And for research question 2, which is, are there disparities in CPS investigation outcomes of maltreatment attributed to fathers versus mothers? We did OLS and logistic regression.
Okay, so this is Julia again. Thanks, Rachel. And these are this is a summary of our findings. So based on some past research, we thought that we were going to find higher severity of maltreatment attributed to fathers, but we actually did not find that clear pattern. So when we looked at mother-alone maltreatment and father-alone maltreatment, for the most part, they were equivalent to each other. There were a few differences, and those differences did pertain both to physical abuse and to neglect. So the only real difference that indicated potential higher risk for father maltreatment was that there was lower intimate partner violence as a co-occurring risk factor when mother alone was attributed as responsible. But otherwise, we actually saw lower mental health problems co-occurring when father alone was responsible, although we wondered if that was perhaps lack of recognition or a measurement issue. And then other differences were in the demographic characteristics of the child. So Black children were overrepresented in mother alone maltreatment, whereas white children were more prevalent, relatively speaking, in father alone maltreatment. Now, when we looked at maltreatment that was attributed to both mother and father together, we did see a pattern of more acute risk. So when both parents were alleged perpetrators, that maltreatment was significantly more severe than the other two groups, and there were more co-occurring problems. So co-occurring substance use, intimate partner violence was the highest in this, and our other co-occurring problems were higher as well. We also found that when mother and father together were indicated as responsible, children were younger on average. So on average, these children were 3 or 4 years, whereas if you look at the father-alone group, that was the oldest group, those children on average were about 7 years old. And so we do think that younger age is also an indicator of higher risk. And then specifically within our neglect subsample, we did find some differences in subtype of neglect. So physical neglect that has to do with meeting a child's basic needs, that was higher for mother and father together maltreatment. But supervisory neglect tended to be more prevalent when there was only one perpetrator, which made sense to us. Here is a summary of our findings from research question 2. So here our purpose is to figure out whether there are perpetrator effects on the CPS investigation outcomes when we control for all of our co-occurring risk factors. So we're looking at father alone and mother and father together with mother alone as the reference group, controlling for maltreatment characteristics, so severity, co-occurring risk factors, and child demographics. And so when we looked at that, what we found was there were some father effects, in other words, indicating potential disparities when we looked at the criminal investigation outcomes specifically. So father-alone maltreatment was associated with higher odds of there being criminal charges as a result of the CPS investigation for both physical abuse and neglect, and both father alone and mother and father together maltreatment was associated with higher odds of criminal investigations for neglect. And so we thought that this suggests some disparities with respect to the criminalization of maltreatment that is particular to fathers. So what does this mean for practitioners? Certainly this is suggestive that there's gender bias that needs to be addressed. The first kind of obvious solution to this is, well, we need to train staff who are involved in child protective services investigations to alleviate gender biases. But we actually believe that this is an oversimplistic solution, although certainly we all have biases, that we suspect that these biases are more systemic and institutionalized in nature. And so we wonder if the lack of services that are specifically tailored to fathers leave few alternatives rather than criminal justice system involvement in some cases. And so we're advocating for a shift from criminalization of maltreatment to mental health services and to maltreatment prevention services. And there's some wonderful father-specific programs that are in development. For instance, this program, Caring Dads, have promising kind of initial results. Criminal justice systems and child welfare systems may be able to work together to divert criminal justice involvement for fathers as well. Although we control for past criminal records, we suspect that that measure was somewhat limited, and so past criminal involvement is probably partly explaining this trend that we find. But in terms of safeguarding children, certainly there are situations where it's necessary to take a strong approach. But our findings also show that there's variability in father-perpetrated maltreatment. So there's maltreatment that's higher risk and there's maltreatment that's lower risk. And in those lower risk cases, with the right services, children can be safely maintained and those relationships could be preserved. So in terms of future research, we suggest future research continue to examine the characteristics of father and mother perpetrated maltreatment using representative samples, but replicating what we found with different measures, more inclusive of maltreatment types. And this is one of our kind of new directions taking with our research now. We need to understand better, does perpetrator matter when it comes to child outcomes? So who the perpetrator is, does that have more or less of effect in terms of the effect of maltreatment on child well-being? And we really don't understand that well at this point. We need to think about other types of bias, including racial ethnic bias, and how that can intersect with gender to impact disproportionality and disparities in the system. And then finally, there's a huge need to develop specific tailored programs for dads and to study the efficacy and the dissemination of those programs in the real world. So thanks, everybody, and we'll turn it to the next presentation.
Okay. Karen is Karen. Okay.
Great. Thank you so much. This is Karen Hudson, and I, along with my colleague Karen Irigard, are really excited to present our qualitative research study entitled Adoption, Implementation, and Consequences of the Inclusion of Fathers with Their Families in Homeless Shelters. This study actually follows my dissertation study, which concluded in 2017. I studied the non-residential fathers' parenting roles and their contributions to the health and welfare of their children that were living in shelter without them, because of exclusionary practices that kept fathers out of residing in homeless shelters with their families. Since 2017, fathers have now been included in shelters, and this study, this exploratory study that we conducted, really allows for us to explore the changes in this inclusion policy. Next slide, please. Okay, so what we were hoping to explore through this research study was we wanted to look at the motivation for the systems change that happened in Philadelphia. Why in 2017 at the time it happened? Why did it happen then? What were the precipitating factors that, were the goal of that? We also wanted to look at and explore the preparation for the systems change. How did the City of Philadelphia Office of Homeless Services prepare shelters, and in turn, how did shelters prepare their staff and the mothers that were living in shelters for the inclusion of fathers? We also wanted to look at the short-term effects of this change in the system, including things like exploring the challenges of introducing fathers now into shelters, the benefits of having fathers in shelters with their families, and also we also wanted to look at just some of the longer-term effects of this change, which included things like how did sheltering, how has it impacted the dynamics of family relationships now having fathers in the shelters with the families. Next slide, please. So just to give you a little bit of context and background for our study, for a very long time, Philadelphia really has been seen as a national leader in providing services to people and families that are experiencing homelessness. And specifically in the state of Pennsylvania, and including Philadelphia, has answered the ACF call to all human agencies to enhance father engagement. So that is probably a part of what helped to move the needle in terms of this inclusion policy. But Philadelphia and Pennsylvania have been on the move in terms of addressing father engagement issues for a while. The specific change that we're talking about happened and came about because of a HUD regulation and guideline attached to funding, such that Philadelphia and their homeless service system had to develop a non-discrimination policy and include fathers, albeit the gender of families, in order to secure the majority of funding that they needed to run their systems. And it was up until 2017 that only 3 out of the 10 family shelters in Philadelphia admitted fathers as residents. And these fathers could be single fathers, or they could be fathers along with their partners and children in shelter. So our study actually took a look at this in a broad range by looking at a multi-stakeholder targeted population. Next slide, please. We interviewed some staff and administrators from the Office of Homeless Services. We actually were goaling at first to interview about 4 to 6 OHS staff, but using a snowball SAM technique, we actually ended up interviewing 13 staff that were interested in participating in the study. We also conducted 3 shelter staff focus groups. One focus group was the focus group that included the 3 shelters in Philadelphia that had long been taking in fathers for decades now. And then our second staff focus group was the focus group of shelters that since 2017 began to adopt this change and took in fathers. And then the last staff focus group that we conducted was with what we're calling the laggard shelters, and these were the shelters in Philadelphia that had not accepted this challenge and this innovative change in inclusion of fathers. And then we went and we conducted 10 parent focus groups in all of across the 10 family shelters in Philadelphia. And these focus groups included both mothers and fathers. We received approvals from the City of Philadelphia and Temple University IRB in order to conduct this study. And our study was guided by a theoretical framework, which was the Diffusions of Innovation Theory study, which really talks about this idea of how you move an idea from an idea to innovation across different time frames. So who adopts early, who adopts later, and who doesn't adopt. And so that was the theoretical framework that really guided our study. Next slide.
So this is Karen Ira-Garg now, and we found that there were a convergence of several factors that led to the motivation for the system change. First, there was this organic movement of attention to fathers who are experiencing homelessness that Karen had talked about earlier. There was also this complaint hotline that the Office of Homeless Services staffs, and they were receiving phone calls complaining that fathers had difficulty accessing the shelter system. And 2 OHS employees were kind of responding to these calls, both African-American men. They both had strong beliefs in the inherent value of fathers. And they really, from their review of all of these phone calls and really reflecting upon the system, they really saw this as systemic discrimination against fathers. And because most of the people who are accessing the shelter system in Philadelphia, because there's just such a huge population of African-American folk, that it's really discrimination against African-American fathers is the way that they saw it. Additionally, HUD has always had this non-discrimination policy, but in 2016 they added another protected class to it. It was focused on gender identity, and it also had some language around sexual orientation. But all the time, they changed their scoring system for continuum of care dollars for how the system is funded, and it really rewarded the cities or the continuum of cares who could show that they were compliant with a non-discrimination policy. What's really interesting is how OHS decided to implement this policy. There are some cities who have interpreted this language as there needs to be a place for every single family or every single person who is in need of shelter. But there could still be female-only shelters or female-headed family shelters, and then more inclusive shelters that would also include fathers. Philadelphia decided to interpret this as we're going to stop discriminating against fathers, period, and that fathers need to be welcome as residents in all 10 of the family emergency shelters in Philadelphia. So the policy was adopted by the Philadelphia Continuum of Care in 2017. It was effective in January 2018. OHS announced this new policy to all of its providers through some provider meetings. They handed out non-discrimination posters that needed to be posted in every single shelter. And they originally communicated it as a recommendation to the shelters, and many of the shelters were responsive to that. But then eventually it did become a mandate that all shelters needed to comply with. In terms of preparation for system change, so there were 15 protected classes that were protected here, but it ends up being that the fathers were really one of the issues. There's just this major challenge around including fathers. So a lot of the OHS work really became around problem solving and how do we make sure that fathers are included in a safe way. So some of the shelters asked for more male staff or security to be on site. And OHS was able to offer some dollars for some shelters who were asking for that kinds of assistance. And OHS also created a formal training that is at some point going to be rolled out to all of the shelters. It seems like some pieces of the training have been rolled out, but the complete training has not yet been rolled out because they still need to include some information in that training about how complaints are handled. The early adopter shelters do remember some training about LGBTQIA issues, but they don't remember anything about including fathers. And we did find amongst those who were the first to make this change once the policy did shift, our late adopters shelters, they spent some time talking with the early adopter shelters, those 3 shelters who had been admitting men for years and years and years. So they talked to them about how do they handle things. They also talked to OHS for guidance around what they could do. And they also worked with their staff to kind of talk through what are their fears, what are their concerns, how can we work through those, how can we form some policies so that everyone feels safe and so that, that fathers are feeling welcome and included. We did find, or the shelters did seem, they talked about those that did have private rooms for families, so a room with a door, felt made the transition much more easily than shelters who had more open communal living space. In order to integrate fathers into those spaces, that was a little bit more challenging. The shelter system also, they have a centralized intake system, and OHS informed intake that parents should be informed at intake that they could be placed at a shelter that has a father living on the premises, so that way people could make the decision at intake whether they wanted to accept the shelter or if they did not want to accept the shelter based upon what level of comfort that they might have with this. So I think one of the really important things to remember here is that Philadelphia is one of the early cities to be interpreting this policy in this kind of way and to mandate the integration of fathers into all of its family emergency shelters. So it's not like they had another that they had a manual or they had someone else to give them guidance, that they were kind of, they were figuring this out as they were going along and doing the best that they very could in order to do some adaptation and problem solving along the way. They visited facilities, they tried to figure out what some of the challenges were and to try to problem solve through that. So in terms of the short-term system change, what are the benefits and challenges of the inclusion policy? We really find that everyone across the board is really believing that fathers are important to include in families and, when possible, to include them in the shelter system to help keep families strong and to maintain those family bonds. Including fathers has really led to diversification among the staffing, and having strong male role models on staff has been helpful for fathers as well as for families in general. The early adopter shelters, so those that had been admitting fathers for years and years and years, so that sometimes men make the settings more calmer. It maintains the family bonds, and it increases family stability, and it increases income at discharge when they're trying to get into more permanent housing. Fathers are, they tend to connect and support one another. They can give mothers a break, and they serve as role models to others. And sometimes the kids just listen to men more than sometimes they do to the moms. So also everyone believed in this general concept that fathers are really important to have included in families' lives, that there were still some concerns that families had. There are these concerns about violence, about men are stronger, and are staff really trained to intervene in any kind of situations that might occur. People were concerned about their safety, particularly men who have a history of trauma. And they also found that services were geared more towards mothers than towards fathers. Staff had questions about how do you deal with relationship squabbles, how do you deal with domestic violence that might occur on site, how do you deal with sexual intimacy that occurs on the premises that everyone can hear. And there could be conflicts of interest in service provision that could be raised. And then in terms of some of OHS questions were, how do we make these shared living spaces work? How do we make the bathrooms work? And that was a question that kept coming over and over and over. And when we talked to parents, sometimes moms had a bias towards a father who would have a woman partner with him and against a father who was a single father. There's like these ingrained racial, gender-based stereotypes that folks really have here, or so it seemed to the research team. A lot of mothers really had a distrust of men because of a lot of the histories that they had. And then when we talked to the laggard shelters that had not yet admitted fathers, they really wanted men to be in their own rooms, not in common areas. They wanted men not to have to share bathrooms with other families. They wanted clear rules and consequences for breaking those rules. They wanted male staff and security, and some of them even requested background checks. And then in terms of longer-term system change, what about like some of these family dynamics that occur? How does shelter living change the family dynamic? So there is just a lack of privacy when living in a shelter, because staff can always come and check on you just to make sure that everyone is safe and things are running properly. So people can never 100% relax. There are some policies around in Philadelphia about how mothers are automatically listed as the head of household, and then that leads to a position of less power for the father, because if the mother and the father could potentially get into some kind of a relationship squabble, the mother could just say, I don't need the father here anymore, and then the father could be forced to leave. There is a stigma that can prevent fathers from entering shelters with family, and we did talk to at least one shelter sometimes would invite a father to join a family after the family had entered the shelter system. And just in terms of living in a shelter, it's difficult to find space to calm down after getting into an argument with your partner. That if you are living in your own place, that you're able to each go your separate ways to calm down, come back together after you calm down. Shelter, there's not a lot of space to go and calm down. There's added tension in adult relationships while at the shelter, so sometimes people get particularly protective of their partners. And staff seem a little bit autocratic at times, could take power away from parents, may criticize different parenting strategies or parenting styles, so some of the autonomy is diminished. And sometimes staff may speak disrespectfully to adults in front of the adult's partner or in front of the children, and that can be confusing and raise issues for some folks. And then in terms of commitment to change, the early adopter shelters who have been admitting fathers for years, they are certainly committed to maintaining the course of including fathers. The late adopter shelters, so those that made the shift, within about 8 months of this policy, they are definitely on board for keeping this policy, it seems like. And OHS is steadfast in their commitment not to go back, as they would say. It is a little bit more tenuous for our two laggard shelters, one who has not begun admitting fathers, and then one who has yet a little bit reluctantly in some ways. But it's really out of a sense of protection for the women who have these histories of trauma, and wanting to make sure that women have a place to go that feels safe. And there's some question about, for these laggard shelters, if we force fathers or force all shelters to admit fathers, are we doing disservice to women who really want to be in a place where there aren't men because they just feel more comfortable and they feel more safe there? Karen?
Okay. So with that, the recommendations are many. And so we divide them by thinking about direct service, advocacy and training, and then some policy issues. And so from a direct service perspective, this provides many opportunities for the shelters to really think about the services that they're providing as being provided because of the child and for the child, and to think about services that are offered both to the mothers in the shelter, to the children in the shelter, but also to fathers in the shelter. As a family unit, here's an opportunity to really make the services that they're providing much more family-centric and not just geared towards the mother or the child, but really not forgetting about the father as well. And so these are opportunities, I think, for the shelter to kind of move forward with a new direction. And then in terms of advocacy,
Karen, we're going to have to move on. So please wrap it up. And sorry.
Okay. So in terms of advocacy and training, here's lots of opportunities to really think about cultural competency training within the shelters, as well as to think about building some public-private partnerships that can really help with fighting some of the challenges of having fathers in shelter, things specifically related to like the structural barriers within the buildings that are in shelters. And I think in terms of policy, here lies an opportunity for us to really think more critically about this intersection between race and homelessness, and to realize how real, in fact, that is, and to continue the dialogue in talking about this so that we can reduce some of the bias and stigma that gets attached to fathers that are recently admitted into these shelters. And I'll leave it there.
Thank you. Thank you. Okay, Christy.
Okay. Hello, everyone. My name is Christy Thomas, and I'm an associate professor at Simmons University School of Social Work. On behalf of my friend and collaborator, Dr. Fernando Medeiros, I'm super excited to share a brief overview of our study on responsible fatherhood groups and domestic violence. Before I move on, I want to note that we use the term domestic violence as synonymous with the term intimate partner violence. We're not using domestic violence as an umbrella term for other forms of violence, such as child abuse or family violence. So as we detail in our report, there is an overwhelming lack of literature on whether and how responsible fatherhood groups address the issue of domestic violence. And this is problematic because they have considerable potential for domestic violence prevention. So the aims of this qualitative study were to explore to what extent and how responsible fatherhood groups are addressing domestic violence in their curricula, factors intrapersonal, interpersonal, organizational, community, and policy levels that act as barriers and supports to addressing domestic violence, and incorporating domestic violence content into responsible fatherhood groups. And finally, strategies and approaches for incorporating domestic violence into these groups in ways that supports fathers' educational and other needs. So our study involved two components. First, we conducted a content analysis of responsible fatherhood group curricula. Specifically, we analyzed the content of 4 core curricula: 24/7 Dad AM, Nurturing Fathers Program, Fatherhood Development Program, and Fatherhood is Sacred and Motherhood is Sacred. We also analyzed 1 domestic violence specific supplement, which is called Addressing Family Violence and Abuse, and is published by the National Fatherhood Initiative. For the second component, we conducted phone interviews with 3 groups of stakeholders. The sample of 40 participants included 10 fatherhood field leaders, which included curricula designers, program founders, and program directors, 20 responsible fatherhood group facilitators, each of whom needed to have at least 5 years of facilitation experience. And finally, 10 domestic violence advocates who have experience collaborating with responsible fatherhood groups, typically designing or delivering domestic violence content in some way. So moving into our AIM 1 findings, our content analysis revealed that none of the 4 core curricula explicitly addressed domestic violence. The Nurturing Fathers curriculum closest, with its emphasis on teaching fathers about power to versus power over. This very much aligns with the concept of coercive control, but that terminology was not used. The good news, though, is that all of the curricula focused on topics that could be used as a doorway into addressing domestic violence. For example, topics such as healthy communication and healthy co-parenting were common and could easily be extended into more explicit discussions about domestic violence. We also found that the Addressing Family Violence and Abuse supplement was a thoughtful and dynamic introduction into the topic of domestic violence, and that it could be a valuable addition to the core curricula. The one challenge we saw, though, which could be a reflection of our small sample size, is that it didn't seem to have been adopted by the facilitators we interviewed. In fact, what appeared to be more common was facilitators developing their own domestic violence-related supplements or activities that they would then incorporate into their groups. So moving on to our second aim, We found a range of factors that both hindered and supported addressing the topic of domestic violence within responsible fatherhood groups. These factors spanned all 5 levels of the ecological model, which include the intrapersonal, interpersonal, organizational, community, and policy levels. So what you see in this slide, in the first column, you'll see the different levels that we focused on. And then in the second column, these are all of the major categories for each of the levels that I just described. So what you can see here is that our data were very rich and led a robust set of findings. And there are many, many amazing quotes that I would love to share with you, but sadly, I don't have time. So in the interest of time, I'm going to focus only on the organizational and community levels, which are written in red font. I'm also going to hold myself back from using any quotes. But if you'd like to learn more about our findings at the other levels, please check out our full report, which should be published very soon. So 4 major categories emerged at the organizational level. First, many participants described their own willingness and commitment to embrace domestic violence as a core concern of fatherhood work, as well as what they saw as an increase in receptivity to domestic violence among their colleagues and the responsible fatherhood field as a whole. A critical aspect surrounding this organizational willingness to address domestic violence was participants' own deeply held personal commitment, which was often informed by their lived experience. Many of the participants shared that one of the primary motivators behind their commitment was learning and healing from their own experiences of domestic violence perpetration, victimization, or both. That said, as the second category highlights, although individual and organizational level commitment is essential, it only goes so far. Programs also need resources to support their efforts. We found that larger agencies, especially those with federal funding, were more able to address domestic violence holistically, which meant not only including domestic violence content and activities in groups, but also collaborating closely with domestic violence programs and hiring social workers with domestic violence expertise to support both fathers and facilitators. For the third category, participants that staying true to the fatherhood groups was an important support for effectively addressing domestic violence. To stray from that purpose would pose a challenge to what can realistically be accomplished with fathers, both in terms of domestic violence education and other program goals. Participants stressed that the primary goals of responsible fatherhood groups in relation to domestic violence should be prevention and, when applicable, connecting fathers with appropriate victimization or perpetration services. In other words, responsible fatherhood groups are not bad or intervention programs. Finally, the last category within the organizational level is the importance of having what one participant termed the right people deliver domestic violence education and support. According to participants, the right people had spent a considerable amount of time reflecting on their own domestic violence-related experiences and had developed ways to use their personal stories of victimization and perpetration to connect with and educate fathers. The right people also were skilled at conveying that they shared a bond with fathers. As one facilitator tells the fathers he works with, quote, "This whole DV thing is not those guys, it's us guys." In addition to verbally conveying a bond with fathers, it is important that facilitators share similar demographics and lived experiences so that fathers can see success modeled and reflected back at them. Finally, the right facilitators must be able to tailor their domestic violence-related content and activities to fit fathers' age, race, income, and culture. For example, several of the Native American facilitators we spoke with discussed the importance of connecting domestic violence with fathers' sense of spirituality and their understanding of their creator. Finally, being tuned in also means knowing that fathers need to learn a more nuanced understanding of domestic violence, and it means believing that fathers have the capacity to change their attitudes and their behaviors. So at the community level, 2 broad categories emerged, one that highlights barriers and the other that highlights supports. So the first category focused on what one participant called framework tensions in the responsible fatherhood field and the domestic violence field, which have resulted in feelings of mutual distrust, skepticism, and resistance to collaborate. These tensions stemmed in part from differing approaches to men who use domestic violence. According to participants, the responsible fatherhood field has viewed the domestic violence field as being shame-based, punitive, and one-size-fits-all in their approach to men, including those who are abusive, which is antithetical to the responsible fatherhood field strengths-based approach. Conversely, the domestic field has seen the responsible fatherhood field as minimizing the impact of domestic violence and protecting abusive men at the expense of survivor safety. Framework tensions also stem from challenges related to what one participant termed comparing oppressions. That is, rather than adopting a lens of intersectionality, each field historically has prioritized the form of oppression that bears down the most on their respective population. For the domestic violence field, the focus has been sexism and patriarchy. For the responsible fatherhood field, the focus has been on racism and poverty. The good news, though, which the second category highlights, is that overcoming these framework tensions is possible and it's ongoing. Participants discussed several important factors that have been helpful to their collaborations. First, finding areas of common ground is essential. These include both fields to end the cycle of domestic violence, caring about the well-being of children, and often serving the very same communities. Second, personal relationships are key to fostering and sustaining collaboration because it builds an additional layer of trust and accountability. Finally, there is a need for mutual education about each other's clientele, work, and challenges. The emphasis we heard was mutual. Participants stressed that in the past it has been one-sided, with the responsible fatherhood field expected to know about domestic violence and survivors, but not vice versa. Our third and final aim focused on exploring current practices addressing domestic violence with fathers in these groups. 4 overarching approaches emerged, each of which contains many innovative activities. The first involves combining cognitive and effective educational strategies to change fathers' norms, attitudes, and behaviors about domestic violence. This approach includes offering interactive, and the key is interactive, psychoeducation about the dynamics of domestic violence and its impact on children, providing supportive opportunities to interact with female domestic violence survivors, and what one participant called deep work, which refers to engaging fathers in activities that affect them emotionally and help them unpack their childhood experiences of domestic violence and other forms of trauma. The second strategy involves embracing a framework that balances empathy and accountability. Participants describe the importance of conveying genuine care and respect for fathers, remaining aware of the multiple forms of adversity that they face, and empowering them to take control over their internal and external responses to situations. The third strategy involved a safe space for domestic violence discussion and disclosure. This included avoiding the use of labels such as batterer, avoiding judgments by focusing on fathers' behaviors rather than their characters, and building trust among group members. Finally, the fourth strategy involved harnessing men's desire to be a good father. The general sentiment was that fathers are more willing to discuss domestic violence and change their attitudes and behaviors when the content is connected to the ways domestic violence negatively affects their children. So in light of these findings, we offer the following recommendations. First, we recommend integrating domestic violence specific content and activities into core curricula rather than relying on optional supplements. Ensure that domestic violence is delivered by the right people. Increase domestic violence education within these groups, but do not try to turn them into batterer intervention programs. Fourth, strategies for addressing domestic violence in fatherhood groups must take into account fathers' experiences of poverty, trauma, oppression, and domestic violence victimization and perpetration. This is particularly relevant to the findings that I didn't go over, which are some of the barriers at the intrapersonal and interpersonal levels. Fifth, efforts to increase dialogue and relationship building between the responsible fatherhood field and the domestic violence field must consider the framework tensions that have existed and work to overcome them. Additional funding is always needed, but we need funding to support not only responsible fatherhood groups, but also domestic violence programs so that they can address domestic violence holistically. And finally, any requirement that responsible, oops, I forgot to change the slide, sorry. Spoiler alert. Okay. 7, any requirement that responsible fatherhood groups address DV must be coupled with efforts to foster attitudes and norms that are genuinely supportive of domestic violence prevention. Otherwise, it just becomes one more requirement to check off. So essentially the takeaway is that there has been considerable progress among many responsible fatherhood groups regarding their norms and the development of innovative practices related to addressing the issue of domestic violence with fathers. But ensuring that this shift continues will require substantially more financial resources, as well as mutual education and relationship building between the responsible fatherhood field and the domestic violence field. So I just want to say thank you to the participants of our study who donated time that they don't have to talk with us, and then also to the Fatherhood Research and Practice Network for funding us, and to Jessica and Jay for supporting us the whole time.
And thank you, Christy, and to Fernando. Okay. Jay, do we have any questions that have come in?
No, yet. The participants, the listeners, can type in their questions in the chat box if they would like to present a question, and I'll read it out loud to one of the presenters if you'd like. So please feel free to do so. And I think we do have some questions that we can pose. Just get things started and before folks start to type in their own questions. So for Karen Garg and Karen Hudson, I was wondering if the Office of Homeless Services in Philadelphia has done anything to include fathers and mothers in planning for father inclusion. It seemed to be important to consult with them rather than just relying on staff to do this kind of planning.
I think that that's a really interesting question, and our understanding is that there has been some conversations that have been happening with fathers around learning more about their lived experiences. One of the things that we heard from the two African-American male staff at OHS that have really been champions for this father inclusion said that they feel like it's early for fathers to really be able to give as much information they possibly can give, because they feel like the process is really just starting, but they want to keep fathers involved as stakeholders, along this process.
I had a question, if nothing's come in, about for the panelists about the role of mandates, father engagement, and we've seen court orders in other areas of public behavior or policy behavior playing a prominent role to sort of move the needle, making engagement or a requirement for funding, suing child welfare agencies for certain omissions or performance patterns or failures to achieve permanency in timely manner, et cetera. How does that? How do each of you feel about that in your respective areas? I mean, in the employment area, even in domestic violence training or training in fatherhood programs. What's the role, I guess, the proper balance of carrots and sticks to kind of move the policy needle?
Sure, I can take a stab at that, Jessica. This is Allison. So in our consideration of these employment policies, there isn't really a mandate in the sense that individuals have to hire quotas or something like that of individuals who have criminal records. But we know in a lot of these states there are some implementation problems, which is going to be, I think, part of the larger story about why there are unintended or unanticipated reactions to policies that are intending to make it easier for people to access the formal economy. So, for example, to throw to throw Wisconsin under the bus a little bit, they show up in our data as one of the most protective policies. But we also know there have been several studies that were done there since some of these employment policies were initially passed, also showing that there still seems to be a lot of discrimination against individuals with criminal records in that state. So there's a gap that I think the other presenters here do a better job investigating for their students between what is the law in the books and how is that actually implemented. And there are a lot of people who can fall through those cracks.
Okay.
I can tag on to that a little bit, Jessica, to your question. So in the child welfare context, there are laws supporting father engagement and actually requiring that they be included as a resource for youth. So there is like that support there that at the policy level. But a potential barrier that I've actually gotten back to our work is in the area of reporting laws. Now, I've struggled to kind of see in the context of our specific study how those are explaining our findings. But there are laws about when maltreatment reports need to be also reported to law enforcement agencies that would be relevant to our findings with regards to criminal justice. And so that's one area of potential like further research and examination to explain our findings. So for instance, if there's an injury as a result of a maltreatment, that would need to be cross-reported. But the laws also vary by state. You know, but again, in our study, we do control for severity, which would explain, like, which would capture an injury. But that's an important consideration at the policy level with regards to the mandate. Yep.
So, Jessica, there are a couple of questions now from from participants. And so one of the last questions that came up is, and this I guess would be for Christy, what type of information would a domestic violence program learn from a responsible fatherhood program to enhance understanding?
Yeah, that's a great question, Shari. Thank you. So I think basically the short version is domestic violence agencies need to have a better understanding of the ways in which racism and oppression affect the men who are being served by fatherhood programs and responsible fatherhood groups. I think that their domestic violence program focused on female survivors, that they really don't have insight into the challenges that these guys face, systematic oppression, and also just the profoundly intense forms of trauma that they've experienced. So it's childhood exposure to domestic violence, child abuse, community violence. So it's sort of, they're living in this petri dish of toxic stress and under violence providers so that they have a sense of, what fatherhood programs are dealing with in terms of the work that they do. I hope that answers your question.
Okay. So, Christy, while you're answering there, I had a question that I was going to present to you. Let's see where it is here. Actually, no, I'm sorry. This would be for Karen Garg and Karen Hudson. Sorry about that, Christy.
That's okay.
Just one. A lot of your recommendations are around policy as a means to improve father inclusion in homeless shelters. But I was wondering about, is there a need to orient mothers and fathers who are entering a family shelter? Going into a family shelter as a family is a huge change and influence on many aspects of family functioning. The boundaries of families are suddenly affected by being in a shelter, the involvement of staff, the involvement of other residents. Is there a need to kind of help families to adjust by kind of understanding what's going to change? So I hope my question is clear to you there.
This is Karen Hudson. I'll take the first stab at that. I do think that that is necessary. And I think that there are a couple of ways to think about this. First of all, we've got to get to a place where communication happens consistently enough that families know when they're going into these shelters that they are now family shelters and not just mother-children shelters. Like that hasn't yet, and that needs to happen. One of our early adopter shelters talked a lot about how he does, in fact, that tone with every family that enters the shelter about boundaries, about relationships within the shelter, about the role of the shelter and how the shelter is there to help shape that child and the family, and that the parents are there simply because of the child. And the way that he described how he introduces this work to the families really seems to be something that other shelters could take something from, and I think really add to in really a very intentional way. And we just didn't hear that from the other shelters, but we do think it's necessary.
Yes. And maybe another question is that was posed by one of the participants. If fathers are included, do mothers lose out? And that's for Karen Garg and Karen Hudson.
Well, I think this is Karen Garg. I think that is one of the points that one of the laggard shelters was kind of raising, and they're actually trying to get they're applying for an exception to the policy, because they really do believe that essentially now the system is discriminating against women who have been traumatized and don't want to live in shelters where fathers live. So I think it is a big question about how a system be inclusive of everyone, at the same time, and have everyone feel safe and included. And is it possible? And then if so, how can a system do that?
We're at time. I want to take this opportunity to thank our presenters, ask them to please stay on for a little debrief at the end. Our slides and webinar tape recording will be posted, as will all the reports on the website for FRPN. Please sign up for our online newsletter to get notification of these materials and future reports, because we have a bunch more that are still that will be posted over the next several weeks. We appreciate of having had the opportunity to contribute to the fatherhood evidence base and fatherhood practice. And Jay and I look forward to doing more work in this area and to communicating with you in the future. So thank you for opportunity and your participation, and best wishes for a fabulous holiday season. And thanks to our presenters.